Welcome to the Hologic Perilynx system tutorial. This is used for the detection of fetal fibronectin. Requirements for this setup includes the analyzer, the label printer, a 200 microliter pipette, the rapid fetal fibronectin 10Q cassette kit, the control kit, and one Perilynx Q set. For this test, a laboratory coat, safety glasses, and gloves should be worn. First, turn the power on from the back of the analyzer to start the system. Take the Q set and select Run Q set QC from the main menu and enter the 6-digit ID as labelled on the device. This is the start of the quality control, which is completed once a day before patient testing. Press Next and insert the Q set for analysis. Once passed for level 1 and 2, select Print to keep for your own records and press Finish. Next is calibration. Enter your user ID and click Next to enter the cassette lot. This is found on the insert provided or in the packet of the cassette you will be using. Carefully enter the calibration code. This is also found on the same insert. It is important to program this code correctly to prevent an invalid result from occurring. Once the system is calibrated, you may print the results and finish to proceed to the next step. Run liquid controls by first entering your user ID. Enter the cassette lot number found in the cassette packet and ensure it is within the expiry date. Start with running the first level of control and press Next. Carefully unpack the control reagent kit box containing the level 1 and level 2 controls. This is a negative and positive control respectively. On the bottle, you will find a clear label stating the control level, the expiry date, and the control lot number. Enter the lot number code in the system and press Next. Label the cassette and insert into the analyzer without the reagent and press Next. The system is now prepared for the addition of a level 1 control. With a pipette, attach the suitable tip. Slowly aspirate 200 microliters of the liquid from the bottle and place into the well of the cassette and start the test. Discard the tip into the sharps and clinical waste biohazard bin while the 10-minute analysis proceeds. Once level 1 passes, print results and finish to continue with level 2 control. Repeat the same steps with level 2 as what was completed with level 1. Prepare the system and once set up, wait for the analysis and print the results before finishing the quality control procedure. Begin patient testing by selecting Test Patient on the main menu. After entering your user ID, copy the cassette lot number into the system and press Next to enter this patient sample ID. In this text box, you may enter a laboratory ID number or the full name of the patient. It is also critical to note that the specimen should be cervicovaginal fluid. Make sure that the label of the tube matches to what is programmed in the system. label the cassette clearly before inserting into the analyzer. The system will check the cassette within a few seconds. Once prompted, open the patient sample tube and collect 200 microliters of the fluid and apply into the cassette well within 30 seconds. Immediately start the test. After the analysis, a fetal fibronectin result from the sample will be displayed on the screen. Print and keep for the patient report. Some of the areas that could occur is obtaining an invalid result. This will identify the problem with a code which is elaborated from the Hologic system manual. The possible failure for the cassette QC is dispensing less than 200 microliters of the control. In this case, repeat to run the control test on a new cassette and ensure the correct procedure is followed. If an invalid QSET message is displayed, restart the analyzer and confirm that the QSET serial number on the device and analyzer matches. This can be verified with the result printout. Also check that the QSET is clean and not damaged. If appropriate, canned air may be used to clean the device. If the QSET QC fails after a rerun, perform the QSET setup and follow the prompts. If the quality control procedure passes, no further troubleshooting is required. General troubleshooting tips include restarting the analyzer, assessing the quality of the QSET or cassette kits, that the correct codes are programmed, and all of the reagents are within expiry dates. If problems do persist, contact the Hologic technical support. Thank you for using the Hologic Perilynx system.